So the question actually goes that having an non-invasive procedure performed at a teaching medical facility, whereby the attending physician tells you it's a common practice to allow the residents and fellows to perform the procedure while the attendant actually instructs and actually supervises it. Now the question goes, am I actually comfortable allowing them, which is a resident of fellow, to perform the procedure, opposed to the attending physician that has like 25 years or like 30 years experience performing these procedures? Now, if you're not comfortable with allowing the residents and fellow to perform the procedure, and you make this clear to the attending physician, I mean, what do you need to do actually? Do you or will you be willing to, press charges? Uh, More like consider that a legal issue for the medical facility, and what category will this fall under? So, from my understanding, I know that as a teaching hospital, or more like a training facility hospital, the residents and fellows always are being used. They have a lot of attendants that work directly with attendance physicians that work directly with fellowship students and also residents, which is which is normal, especially in the training uh, training facility. Now, the thing is, what I've noticed in the teaching hospital is that you can actually have some certain academic benefits afforded to you by more like the virtue of the academic arrangement. For the fact, the residents and fellows are highly supervised by the attending physicians, and in every part of the documentation, their rounds, their learning environment, they have the policies are right that are contained in the handbook, which is called the GME handbook, and this right actually protect them from any adverse actions and decisions that are being considered. For me, I mean, I don't know. For me, I just feel very comfortable letting either the residents or the fellowship perform the procedure for me because I know and I believe that they've been professionally trained. They are being supervised and also advised before decisions have been taken. So the residents and the fellowship work hand in hand with the providers. So each time the providers are about to like do a surgery, do a procedures, they actually use the residents to do the documentation. So pretty much they do a lot of documentations, they do a lot of, and they actually come over to the physicians, tell them about whatever their point line, and also tell them about the observations about the patients, and then the physician take it from there, and based on his expertise, based on his experience, can actually say, okay, this is the decision making that I propose for this patient. So the residents and fellows are actually individuals that have worked side by side with the attending physicians, regardless of the huge number of experience the physicians might have already had. Now, I am very comfortable with such procedures. It really don't matter to me. But what if I do not feel comfortable? What happens? What do you think I can do? Well, for me, if I don't feel comfortable for the residents or fellow to perform the procedures, based on my, maybe I had like my experiences have been really bad um, working with say residents or fellows, and I'm very particular and to say that this is what I want. I do not want. I really want a physician. I mean, I'll definitely. I believe I have a right. First of all, I do have a right as a patient to choose who I prefer to do my procedures. So I could decide I don't want my procedures done by the resident. So it's my preference. So they should actually honor it. They should respect the fact that I want it. And now, if they do not respect the fact that I don't want the residents, then I'll definitely move forward with legal issue for the medical facility. I believe as a patient, I can actually have a right to choose what physician I prefer to carry out with a non-invasive. Um, I will decide to press charges moving forward, and this might be considered a medical professional liability because this is going out of hand. I believe the physician, regardless of the fact that they supervise these fellows and supervise the residents, I still believe if I want to say that I do not want the investing procedure to be done by them, they should actually respect that decision.